Hello guys and welcome back to our channel CMS Prep. Today in this video we are going to be discussing all the questions related to poisoning in pediatrics which have been asked from 2009 till 2024. So let us begin our discussion. Consider the following statements. Gastric lavage is contraindicated in children in case of iron poisoning, kerosene poisoning, corrosive poisoning and aspirin poisoning. So iron forms concretion in the stomach and causes gastric necrosis. So gastric lavage is not useful and not indicated in the case of iron poisoning. Now kerosene poisoning. Kerosene poisoning consists of hydrocarbon which is highly volatile and causes a significant risk of aspiration pneumonitis. Hence it is contraindicated in case of hence gastric lavage is contraindicated in case of kerosene poisoning. Corrosive poisoning. Gastric lavage is contraindicated in case of corrosive poisoning as it can increase the tissue damage and lead to perforation and necrosis. Now the last option, aspirin poisoning. Gastric lavage is when there is case of large salicylate poisoning and presented within 12 hours. So the correct option is option number 2 and 3. Gastric lavage is contraindicated in which of the following? First option, corrosive poisoning. Yes, it can increase the existing tissue damage, so it is contraindicated. In organophosphate poisoning, gastric lavage is not contraindicated. It can be used in severe cases which are presenting early, so it can be used in those conditions. Iron intoxication. Iron intoxicated because it can lead to perforation because it can cause concretions, but the treatment of iron intoxication is whole bowel irrigation. It is not generally done by gastric lavage. And turpentine ingestion is a contraindication for gastric lavage because it contains hydrocarbon which can cause aspiration. Therefore the correct option is option number D, 4 and 1. In which of the following poisoning gastric lavage is contraindicated? See here, kerosene poisoning and corrosive poisoning both are correct, but more specific is corrosive poisoning. Why? Corrosive substance cause severe damage to the gastrointestinal tract, and gastric lavage can exacerbate the existing injury or lead to a perforation. While kerosene and iron poisoning are also contraindication, but corrosive poisoning is universally recognized as a strict contraindication, so this is the most correct answer. In a child with acute organophosphate poisoning, which one of the following drug will act as an anti-sialogogue and peripheral parasympatholytic agent? See, what happens in organophosphate poisoning is that they block the enzyme acetylcholinesterase, and due to this there is a buildup of acetylcholine and it binds onto the muscarinic receptor and produces the parasympathetic effects such as salivation, lacrimation, urination, diarrhea, emesis, etc. So if we can block this muscarinic receptor, we can reverse the action of organophosphate. So the correct option is atropine. Atropine acts as an anti-sialogogue, that is reduces salivation, and acts as a peripheral parasympatholytic agent by blocking the muscarinic receptors. It counters the cholinergic effect of organophosphorus poisoning. Other options, paralidoxim, do not have anti-sialogogue properties, so the correct option is atropine. Which one of the following toxidrome are a group of symptoms which are produced by certain poisons? Which of the following toxidrome is associated with consumption of pesticide containing organophosphate? So if a person is consuming organophosphate, it will block acetylcholinesterase enzyme, so acetylcholine will increase and acetylcholine increase, so it will lead to increase in cholinergic activity. Okay, so this is the correct option. Next question, which one of the following is primary antidote given in children with organophosphate poisoning? So again the correct answer is atropine. Atropine will block the muscarinic receptor and will reverse the cholinergic effect of organophosphate. Antidote to reverse the muscarinic effect of organophosphate toxicity is, so the antidote to reverse the muscarinic effect is atropine. Atropine reverses the muscarinic effect by blocking acetylcholine receptor site. So this is the correct option. And paralidoxime, what it does is that it reactivates acetylcholinesterase enzyme, but does not directly address the muscarinic symptom. Hence the correct option is option number B. A 4-year-old child is brought with a history of ingestion of 1 gram paracetamol 2 hours back. What should be the initial management? See, what paracetamol does is that paracetamol is used for fever and mild pain. It is metabolized by liver by 3 processes. The first one is glucuronidation, the second one is sulfation, and the third one is by cytochrome P450 enzyme pathway. And in this pathway, an intermediate is produced, that is NAPQI, that is N-acetyl para benzoquinone imine, and this one is the main culprit. It is highly reactive intermediate. And glutathione, what glutathione does is that it counteracts this intermediate, but a time comes when NAPQI exhausts all the available glutathione, so it builds up in the liver, causing liver damage and other systemic symptoms. So N-acetylcysteine is given. What is N-acetylcysteine? N-acetylcysteine is a precursor of glutathione, so it will increase glutathione, which will help in counteracting the poisoning effect of paracetamol. So the correct answer is oral N-acetylcysteine. Now moving on to the next question. Consider the following statement regarding paracetamol toxicity. Toxicity is caused by intermediate reactive metabolite that binds covalently to the cellular protein, causing cell death. Yes, it is true. NAPQI binds to the cellular protein, causing cell death. Antidote for paracetamol act by replenishing the hepatic glutathione and should be administered to all patients with acute poisoning. Yes, this is also correct option. Methionine may be used as an alternate antidote but is less effective than acetylcysteine. This is also correct. And intravenous acetylcysteine is a highly efficacious antidote if administered within 8 hours of overdose. This is also correct. So the correct answer is 1, 2, 3 and 4. 4-year-old ingests many tablets of salicylate. What complication is likely to develop? See, salicylate is basically aspirin, and aspirin is given for fever and pain, but if taken in large quantities it can cause poisoning. And the main effect of aspirin is that it decouples phosphorylation pathway, so there is buildup of lactic acid which can cause metabolic acidosis. So the correct option is D. Due to metabolic acidosis, bicarbonate loss can cause hypokalemia rather than hyperkalemia. Rhabdomyolysis is seen in crush injury and statin toxicity, not in salicylate toxicity. And prolonged QRS is seen in drug toxicity, tricyclic antidepressant rather than salicylate. So the correct option is metabolic acidosis. According to the King College criteria, which of the following are indicator for referring to liver transplantation following paracetamol toxicity? See, if there is paracetamol toxicity, it is of severe case, we need to consider liver transplantation. So for this, there is King's College criteria. In this, following points are included. The first one is acidemia. If the serum pH is less than 7.3 even after fluid resuscitation, coagulopathy, and renal dysfunction, that is creatinine more than 3 to 4 milligram per deciliter. These conditions, if they are met, the patient is considered for liver transplantation due to paracetamol poisoning. This is also an indicator of liver damage but not included in the criteria. Okay, so the correct answer is 2, 3 and 4. Now moving on. A child presents to the emergency following ingestion of around 20 ml of kerosene about 40 minutes back. The child appears to be stable. Which of the following measures should be taken for the management of child? Kerosene contains hydrocarbon and is highly volatile, so we do not do gastric lavage or forced emesis because it can cause aspiration. So the first option is out. As the child is stable, so there is no need of oxygen therapy and there are no sign of inflammation, so intravenous steroid is also out. The correct option is radiography. A chest x-ray is needed in case of kerosene poisoning because aspiration pneumonitis can occur. So to monitor it, we take a chest radiograph. Okay, now next question. An asymptomatic 3-year-old is brought to the emergency department 2 hours after accidental kerosene ingestion. The appropriate management is gastric lavage is contraindicated, inducing emesis is also contraindicated, and charcoal hemoperfusion is not effective for kerosene. So the correct option is chest x-ray and observation. Okay, next question. Whole bowel irrigation is a method useful for decontamination with poisoning of. So alcohol is rapidly absorbed, so whole bowel irrigation is not effective. Kerosene whole bowel irrigation is not done due to the risk of perforation or aspiration, and organophosphate poisoning is mainly managed with atropine. So the correct option is iron. Why? Because iron forms concretions in the gastric mucosa leading to gastric necrosis. So whole bowel irrigation is a suitable method for decontamination with iron. Next question. An 8-year-old child has consumed few tablets of drug that were taken by his mother on regular basis. Following this, the child develops gastric necrosis, acidosis, shock and hepatic necrosis. What is the most likely drug? See, iron forms concretion in the gastric mucosa. Now due to that, it leads to gastric necrosis, then it leads to perforation, and the iron is in the blood. It causes metabolic abnormality leading to increased lactic acid, so it causes acidosis, gastric necrosis, perforation, and perforation can lead to shock, and increased iron load on the liver causes hepatic necrosis. So the correct option is iron. Multivitamin, calcium carbonate and folic acid do not cause poisoning with such severe symptoms. Okay, so the correct option is iron. 16. A child with high anion gap metabolic acidosis poisoning with which of the following may be suspected? See, digoxin poisoning is associated with CVS symptoms. Rifampicin mainly is associated with liver toxicity and hypersensitivity symptoms. Beta blocker may cause bradycardia and hypotension, but iron toxicity is associated with high anion gap metabolic acidosis due to production of lactic acid. Okay, so the correct option is option A. Now let's move on to the next question. A child is brought with a history of ingestion of an unknown substance. On examination, he has excess salivation, lacrimation, meiosis, and gastrointestinal cramps along with emesis. What is the most likely substance ingested? See, tricyclic antidepressant causes anticholinergic action. So here the symptoms will be dry mouth, less salivation, so this is not correct. Opioids generally cause CNS depression, respiratory depression and pinpoint pupil. This is also not mentioned. Phenothiazine is a antipsychotic and its toxicity may produce extrapyramidal symptom, which is also not mentioned yet. So the correct option is carbamates, which block acetylcholine esterase and leading to cholinergic symptoms, which are mentioned over here. Okay, so the correct option is carbamates. Now the next question. A 3-year-old child develops respiratory distress after inhalation of fumes arising from burning plastic. The child is started on supportive ventilation. Which one of the following antidotes needed to be given? See, when we are burning plastic, okay, so the plastic produces cyanide, and this cyanide causes histotoxic hypoxia. Basically, it blocks the complex 4 of the ETS and leading to decreased ATP and therefore causing hypoxia. Okay, so if we give hydroxycobalamin, what hydroxycobalamin does is that it binds with cyanide and converts it into cyanocobalamin. And what is cyanocobalamin? It is B12, which is excreted by the urine. So the correct option is hydroxycobalamin. Amyl nitrate and sodium nitrate can also be used, but there is a risk of methemoglobinemia while using this, so these are avoided, and the correct option is hydroxycobalamin. Okay, and N-acetylcysteine is antidote for paracetamol poisoning. Okay, so the correct option is hydroxycobalamin. Next question. In case of a child with acute poisoning by ingestion, activated charcoal may be used in which of the following situation? So for lithium ingestion based on the dose, the hemodialysis may be need to be done. For corrosive ingestion, we do not use activated charcoal as it can lead to increase in the complications. For iron ingestion, we have already discussed, it is whole bowel irrigation. And for anti-epileptic ingestion within few hours, activated charcoal will help. Okay, so the correct option is option B. Now let's move on to the next question. Question number 20. Poisoning with which of the following causes hypothermia? See, alcohol causes hypothermia due to vasodilation, but it is not as significant as chlorpromazine. So chlorpromazine is an antipsychotic medication. It can disrupt the thermoregulation, leading to hypothermia as a side effect due to its sedative property affecting the central nervous system. Okay, so the correct option is chlorpromazine. Now let's move on to the next question. A child after snake bite develops petechiae, ecchymosis, and also develops bleeding from the venipuncture site and oliguria. So the most likely species is, so out of this, python is non-venomous, so it is already out. Cobra and mamba are neurotoxic, so they will cause paralysis like symptoms, so these are out. And so viper secrete hemotoxin. Okay, so hemotoxins will cause the above mentioned system because they will cause they will disrupt the coagulation pathway, petechiae, ecchymosis, bleeding from the gums, venipuncture side, and this hemolysis may lead to renal damage causing oliguria. Okay, so the correct answer is pit viper. Now the next, match the following. So the first option is calcium sodium edentate. Calcium sodium edentate is primarily used for lead poisoning. It chelates lead and facilitates its excretion from the body. Sodium nitrite. So sodium nitrite is used in cyanide poisoning. It converts hemoglobin into methemoglobin, which binds with cyanide, allowing for its secretion. Methylene blue. So methylene blue is antidote for methemoglobinemia, which can occur after nitrobenzene exposure and other condition that cause elevated methemoglobin level. Atropine is an antidote for organophosphate poisoning. It acts by blocking the excessive muscarinic effects of acetylcholine. Okay, so the correct option is option D, 3124. In this, basically you have to remember the drug and the type of urine that is produced if poisoning occurs. So cephalosporin, pink urine, it is correct. In chloroquine, it produces brown urine, it is correct. It is due to hematuria, this is due to myoglobinuria. Okay, now the next one, phenazopyridine. It produces red orange color, and amitriptyline produces green blue color. So these are incorrect, so the correct options are only two pairs are correct, so this is the correct option. Okay, now let's move on to the other question. Question number 24. Which one of the following antidotes are considered obsolete? Obsolete means not used nowadays. Okay, so universal antidote is not used. Why? Because it lacks specificity and efficacy. So specificity and efficacy are missing, so it is not used. Flumazenil is used for benzodiazepine but not used nowadays because due to risk of seizure and complication in mixed drug overdose. So the correct option is 1 and 2 only. Okay, now let's move on to the next question. Question number 25. The following drug is the antidote for benzodiazepine poisoning. So the correct option is flumazenil. Flumazenil acts as competitive antagonist at the benzodiazepine receptor, that is GABA receptor. Okay, it competitively antagonizes it, reversing the effects of sedation. So correct option is flumazenil. This is used for opioids, this is used for organophosphate, and this is also used for organophosphate. Urinary alkalinization is used for enhancing the secretion of which of the following poisons? See, if a thing is not charged, it will cross the lipid bilayer, and if a thing is charged, it will not be able to cross the lipid bilayer. That's the whole concept behind urinary alkalinization. So we increase the pH of the urine so that if there is a weak acid, okay, if there is a weak acid in alkaline state, it will become ionized, that is, it will become charged and it will not be able to cross the lipid bilayer membrane, hence it will be secreted out via the urine. So out of the following options, phenobarbital or phenobarbital is a weak acid that can be excreted via urinary alkalization. Urinary alkalinization as a method of enhancing excretion for poisoning is aimed at achieving. So in this we aim that we make the urine pH between 7.5 to 8 by adding bicarbonate. Okay, so by that we can make the urine slightly alkaline, and by which we can excrete the acidic poison, weak acids like salicylate, or we can use phenobarbital, and we can also acidify the urine to secrete some weak bases, okay, like amphetamines. So the reverse concept is also true. So this is the whole thing about urinary alkalization, and by this we have covered all the 27 questions that were asked from pediatric poisoning from 2009 to 2024. If you have enjoyed the video, kindly like, share and subscribe to our channel. If you want to attempt the quiz, you can go to our Telegram channel, that is CMS Prep, and attempt the quiz over there. PDF of this will be provided over there. Thank you. Stay connected for other topics.